Hi. On behalf of the Inner Wheel Club of Coventry, I would like to welcome Jordan Smith to talk to us about Global Care, a local charity which we have supported for many years. So Jordan, please would you like to unmute yourselves and tell us about yourself and the charity? Thank you.
Yes, absolutely. Thank you so much, Janet. It's as Janet has said, my name is Jordan. Are you all able to hear me? Okay, just give me a thumbs up. Okay, wonderful. Yeah, so thank you so much for such a warm welcome as well. It's a real privilege and honor to be here and see you all. I am the only male here, which is something you don't get to say every day in a Zoom call. But yeah, it's just a delight to be with you and see you all, and yeah, just get to share a little bit today about Global Care and something maybe that you know a lot about, or maybe a little, but giving an update really on the last year, where one of the largest impacts really of the last year, whether it's global care in England or elsewhere, has been COVID-19. And just sharing a little bit about that, but also just some of the struggles and some of the challenges that we've had to overcome, but also just some of the victories as well, and the things to celebrate really in this time. So yeah, just excited to go into that a little bit. So as it's been said, my name's Jordan. I am 23 years old. I've been at Global Care just a year and a half now. So I'm still quite a fresh face, but it's an incredible place to work, and I'm extremely privileged to say it's my place of work where I get to serve and yeah, do a little bit, serve a little bit here and there, and work with the amazing team and with the children we work with. So I am just going to share my screen, and I'm going to bring up a presentation. So I'm going to put this on the large screen. Again, if you can see that, could you just give me a thumbs up and I can see? Okay, wonderful, just a wave. Lovely. Okay, so today I'm going to be sharing about Global Care, just a reminder as to who we are, what we do, and our heart. But like I said just now as well, just the COVID-19 response, and share a little bit about that today. So just a roadmap of really this presentation or this talk is I'm going to share a little bit about Global Care, like I just said, also saying about the COVID-19 response, and I'll allow some time at the end where if people have questions or if they want me to go into further detail about anything, maybe I've skimmed over quickly, then by all means, just let me know and I will do my best to answer. And if I don't know the answers, I will ask someone who knows better here, and I can email that out to you if you'd like some more information. So yeah, that's kind of the plan for today. So Global Care is an international Christian children's charity which helps children access education as a means of bringing sustainable and positive change in the societies we work in. So a bit of a mouthful, but essentially just to draw your attention to, we are a Christian charity, and we love and have a heart for caring for vulnerable children. And when I say vulnerable, this is some of the most vulnerable of the vulnerable in their different respective societies. So whether it's the abandoned children, orphans, or children with disabilities, more than that as well, we don't want to just help the children on maybe a year or a certain period of time, but we believe that education is such an important and incredible way to make a change and make a positive change in different children's lives, as well as their families, whether it's the different people that they're surrounded by in their different environments. But when we talk about this, we want it to be sustainable. So we don't want the children to have a nice experience, maybe benefit for a few years. We would love it that they're equipped and empowered to continue on through the rest of their lives, and that they come away with something that is important and that they can act in for however long it is they choose to work in or be in part of that area, and then take it away with them to different areas. So this is just a little bit of a map as to highlighting where we work. So we have there's a large number of countries here. Some of them, as you'll be able to see, and as you may know already, we have multiple projects in. So for example, in Uganda, we work in primarily Soroti, Rukungiri, and Kampala, but there's also different work there. So there's disability centers and there's different work we have there. So that's kind of a bit of just to give you a bit more of an idea as to where we work, but also to know that there is further work within there than just an infographic. So just going on to a bit more about this next section is just to share a bit more of the COVID-19 response. So again, something that I don't think anyone really predicted could happen this time last year. I think around this time last year, it was popping up on the news about COVID-19, the beginning of this virus that was spreading. But just the extent and the scale that it jumped to of a global pandemic was something I think that definitely shocked me, many people, and probably all of us here. Also with a lot of people here in England, around the world, we ourselves would have been affected in one way, but there's also many, many different countries around the world that were affected so much differently. And actually the impact was a lot more, proved more of a detriment in different societies. So I'm just going to be going through a few of those countries, a few of those projects. So number one is on your screen, as you can see, we've got Street Kids Direct in Guatemala. So the initial impact was the lockdown of businesses, schools, and public gatherings from the 21st of March, this being last year in 2020. Just a bit more context as well is that Street Kids Direct, they do an incredible work, as do all of our projects, but alongside working with street children, they also have a mentorship program. So they look to speak to children and say to them, listen, if it's great that you're accessing education, but the way that you're living, if you continue to want to do your own thing, behave in the same way, continue in your behaviors you've been doing and the patterns of your living, it's not good. And actually it's probably going to end up like this. And it just really helps correct people's mindsets and break down a lot of walls and barriers, and helps children just to say, actually, I want to do something that is going to be beneficial. I don't want to do something that's going to be silly, stupid, or wrong in the future. So they're encouraged actually to continue at Street Kids Direct from mentorship alongside the actual schooling and helping them. So COVID responses, 70 families have received food, essential items, educational materials, and board games. And this is something where we continue to work with them, continuing to provide and help them access the educational resources that they need as they are still in lockdown at this current point in time. So it's still ongoing, but we continue to work with those 70 families and the different children who are sponsored by the different partners, different sponsors within Global Care. Next is Bangladesh, Love Your Neighbor. The initial impact was a lockdown imposed on businesses, schools were closed and gatherings prohibited from the 26th of March. And the COVID response being food and essential items, including face masks, soap, cleaning materials were provided for 328 families. And also additional food was provided for 400 small children. By small children, what I'm also referring to is normally children between the ages of 2 or 3 to 10 or 11 years old. So it's that age range. As you can see on the images as well, you can see at the top, really, there's people awaiting the delivery of resources and some of the things listed in the COVID response of food and such. And they're keeping, as we know, social distancing as well. From the top picture down to the bottom left, you can see just being able to continue to work within the means of what the government restrictions say. So still honouring as well what the government has set while trying our best to support them. So that's Bangladesh. In India, there's, like I said before, similarly to Uganda, we say we work in India, but there's also different projects that we work in. So there's Emmanuel Ministries, Global Care Foundation in Mumbai. So the initial impact was the harsh, and when I say harsh, I think I'm being quite light with my language here, but extremely harsh enforcement of lockdown measures, including businesses, schools, and gatherings from the 23rd of March, so that lockdown beginning. And this lockdown continued in containment zones from the 1st of June last year. The reason why as well, I know I skimmed over it, but harsh enforcement, the way that this lockdown was imposed was one that is just completely, I think from my standard, whether it's coming from me as from a point of privilege living in England, whether it's myself living here in England or people around the world, recognize the situation of this lockdown as very wrong and very immoral. And what I mean by that is people, no matter where you lived, you had to stay in your homes, which means that for people who live day to day and get food on a day-to-day or weekly basis, that meant whatever resources were in their home was what they were limited to. So for families who didn't have food and wanted to venture out in the hopes of getting some kind of food or getting what they needed, they would actually, if they were caught, they would actually just be publicly beaten in the streets. Not with everyone, but this was quite common throughout and around the country. So when I say harsh enforcement, I just wanted to make that clear as well. But jumping forward, so the COVID response in Emmanuel Ministries being funding sent for feeding for families connected to the Pavement Club. So Emmanuel Ministries has think of it in two sections. You've got Pavement Club, which is where children from streets, they get their basic education, begin to grow in an understanding of the basics of, mathematics, English, art, science. And from that, when they get to a level which is actually, they've established the basics, they move on to Emmanuel School. So that's, both of them are important, but both of them serve different roles. And then the second one being Global Care Foundation in Mumbai, the COVID response being 5 rounds of feeding, funded over 200 families and 900 children. So that was able to provide feeding, as well as you can see in the image, there were some other supplies given out as well. So sanitary products and also educational materials. So just helping the children really continue their education despite being in a very strict lockdown. Next is Sri Lanka, Morningstar School Centre. The initial impact was the national lockdown, school closures, all community concern programs were closed from the 20th of March, which is a huge decision because some people, not just in Sri Lanka, but throughout some of the other projects have said, these projects are literally a lifeline. So when these are cut off, this is not just school is closed. This is a lifeline and a way of living that is completely disrupted. It's a good way to put it, I feel. The COVID response, though, at Morningstar School in Sri Lanka was funding for food for 48 families, educational materials for 60 children. So those are the children who are sponsored by different people in England with Global Care, but also some children who we are hoping will be sponsored in the future as well. And feeding for 24 children and 59 adults connected to Cadella. So when I talk about families as well, this does not always mean, the parents, brothers, sisters, who it may be. Sometimes this is guardians, so maybe it's the older brother and or older sister of the child who is at Global Care. So just to give, a bit more context as well as to that word family. Next is Global Care Albania. The initial impact was the lockdown of businesses and schools on the 16th of March. So really, as you can see, and as you probably know, the lockdown, not just in the UK, but also throughout the world, really was in March from beginning to end, or varied throughout. The COVID response was food and water for 150 families from Rivershore Egyptian community and prescription medication for 12 people. These 12 people in particular being in quite desperate need of those prescription medications, whether it was vaccines or different illnesses that people had where they needed immediate medical attention. And then just to finish off, summer school and feeding for 70 children throughout August, which is amazing. And we're so thankful as well that, this has been able to, the children, the families, with our project partners working extremely hard, have been able to do this. I know I'm skimming over quickly, but I definitely don't want to take away from the fact the amazing work that our overseas partners have had in making all that we're reporting a possibility. Just to skim through before going into Uganda, and Kenya, which are our big projects. In Ethiopia, our Addis Kadam Baptist Church, as well as Zambia and LAFT, which is New Life Action Foundation Trust, and then Helberg Child Care Center in Zimbabwe. The initial impact was all the same for all these three, which is the lockdown of businesses and schools throughout March and the lack of facilities for hand washing and sanitation. So some people not having toilet facilities or toiletries within their homes, so needing to venture out into accessing cubicles or places to use the toilet. Some people weren't even allowed to access these, which is shocking, isn't it? But the COVID response in Ethiopia being distribution of water, containers, soaps, and cleaning materials to 250 people. and hygiene awareness training delivered to communities. In Zambia, soap and sanitizers to promote preventative action and food for 34 families, and also tuition for exam classes. So just children to be able to not be hindered as much as what could have been if they weren't able to continue their learning at that time. So also Zimbabwe, the COVID response being soap, detergent and cleaning materials for 21 children at the center plus staff and their families. And also in addition to this, 29 other people. So this additional group are external to the children that we normally support, if that makes sense. Yeah, and our final two big ones, I've saved the big ones to last because these are our largest projects. So firstly, in Uganda, in Kampala, Rukungiri and Soroti, the initial impact was schools closed and lockdown of businesses, schools and public gatherings from the 30th of March of 2020, and also the significant inflationary, sorry, couldn't even speak English then, significant inflationary impact on food and travel prices, particularly following recent locust swarms, limited distribution of food to vulnerable families by government agencies. So the reason why I've included as well a locust swarm was not only was most of Uganda affected by COVID-19, but Uganda, as well as some other countries in Africa, they also experienced one of the largest locust swarms that they've had, which absolutely decimated crops. But linking it in as well to the COVID response in Uganda, and just to celebrate as well that because of the sustainability built up over the years, actually that effect of those locust swarms wasn't actually as harsh as it could have been, because the people there have done so well in preparing for those sorts of events. So that's just another thing to celebrate here, even if it's not written down. So in Kampala, essential food, soap and detergent delivered to 120 families with sponsored children. In Rukungiri, food, soap and essential items delivered to 119 families of sponsored children and 18 families from CWDR, which is Children with Disability Rukungiri. And finally, for Soroti, food, parcels, soap and essential items were provided for 162 families of sponsored children, inclusive of children from the ARC. So the ARC is a disability centre for children particularly affected with physical health problems or mental disabilities. You can see as well in the pictures on the bottom left, those are some of the children from the ARC. So one of the boys down there in the wheelchair. And then finally, just a note as well, food parcels were delivered to 113 families in Abaco and Atira, so just the surrounding areas. And then finally, just a note, Kenya, which is one of our other large projects at Spurgeon's Academy in Garissa. Spurgeon's Academy is a school with many hundreds of children, so we're talking about the high hundreds of children, which means that even though with our sponsored children, our sponsorship program, whenever someone signs on to sponsor, it's always children from Spurgeon's Academy. And these are children who are affected particularly with HIV and AIDS, or being orphaned and abandoned. So the initial impact at Spurgeon's Academy was the lockdown of businesses, schools, churches, public gatherings since March the 15th. Social distancing and maintaining recommended levels of hygiene was very difficult in densely populated informal settlements like Kibera, which is the poorest and most and largest slum in Kenya. If you ever want to see, if you type it into Google Images, Kibera slums, it is awful. It is it's a place where some of the most extremely vulnerable children we work with live. But also access to water and latrines was limited. Also, because of the lockdown, it inflated prices of this, so hence the more expensive amounts of money. And in Garissa, the lockdown of small businesses and casual laborers, recent flooding had already placed significant strain on local resources. So just further problems, but not due to COVID, but just in regards to the normal issues in Garissa in Kenya. And yeah, the COVID response in Spurgeon's Academy, 300 families were able to be fed in 2 rounds of feeding. face masks and hand sanitizers for all students at Spurgeon's Academy, which is approximately 450 children, external as well to the sponsored children. So again, just to provide the more context with the children who are sponsored as well as the children who are not, and 30 hand washing stations with soap and water for over 2 months. Those were able to be set up, and even though it says for 2 months there, we've also been able since to be able to renew these and continue these stations. And in Garissa, food, hygiene, sanitation items, and provision of face masks for 75 families. You can just see there in the images as well, some of the packs and parcels that were given out for different people to, to be delivered to different people. And then on the bottom left as well, you can see a family who, outside of their grass thatched house, some of the supplies that they've received, including cleaning products as well as food. Yeah, and really just to cap off as well, I know I've spoken a bit and there's going to be some time for questions now, but just to capture everything in a single infographic, just to celebrate some of the incredible things as well. You can see some of the key statistics there of over 8,400 people being able to benefit, 4,068 food parcels being delivered, 24,000 people who were able to be delivered hygiene packets or sanitizers, different things like that. I'll let you see, I'm not going to narrate everything, but just as well to draw out that key figure of, as of 25th of September 2020, £132,000 had been donated to Global Care and used to be able to make all of the statistics and things that I just shared possible. And since then as well, like this is an infographic from back in September on 25th. But since then, we've been able actually to raise about £165,000, which is incredible because people just continuing to be faithful in their giving and making this work with vulnerable children continue to be possible. So thank you for listening. That is, I don't know if you wanted me to speak more or you're sick of hearing my voice, but thank you so much for listening, and for those of you as well who continue to keep us in your prayers and continue to support us. It's a huge blessing, and it enables us to be able to do what we do. So thank you. If there's any questions that people would like to ask, I'm more than happy to answer. Thank you.
Well, Jordan, that was a very interesting talk. I've learned quite a bit, and I was surprised you do cover a terrific area and countries. So thank you very much for that. And let's hope the shops will be open soon, so you'll be having more money donated. So thank you very much.
Thank you so much, Pat. And thank you everyone else for your time.